This chapter will discuss sideline assessment following a suspected concussion. Despite ongoing research and the advances in technology, specifically blood-based biomarkers, biosensors, and diagnostic imaging, concussion remains a clinical diagnosis reliant on comprehensive and multifaceted examination by a medical professional trained in the diagnosis and management of sports-related concussion. Suspicion of a possible concussion and the subsequent need for evaluation can be triggered for multiple reasons during the sporting event. These include self-reported symptoms by the player, a big hit or evident head contact spotted by the medical staff or a sign spotter from the sideline, and suspicion of an injury by a teammate or coach. For example, a player not remembering a play or an assignment during the game. Valuable information related to potential injury can be obtained through careful observation of the field of play during the practice or game. For example, does the situation involve a downed athlete with potential loss of consciousness? Or did you observe a stumble, fall, or episode of incoordination following a contact? Or does the athlete appear confused or different from his or her usual self? Additionally, both a cervical spine assessment as well as a neurological examination should be performed to rule out more serious cervical and neurological injury. To do this, I would palpate the cervical musculature, checking for spasm and tenderness. I will also check for active and passive range of motion. An upper and lower quarter screen should also be performed, which includes assessing dermatomes, myotomes, and reflexes. A neurological examination emphasizing pupil reactions and extraocular movements should also be carried out. I'm going to ask you a few questions. I'd like for you to listen carefully and answer as best you can. What month is it?
August.
What is the date today?
The 28th.
What is the day of the week?
Friday.
What year is it?
2015.
What time is it right now?
Around 1:45.